The Ford government refused to repeal Bill 124 despite knowing it was a driver in the critical shortage of healthcare workers in hospitals and long-term care homes during the pandemic. Tonight, a flood of reaction to the revelation of these damning documents.
It really shows that the premier and the minister have failed in their duty to protect our healthcare system.
A Freedom of Information request filed by a Toronto news outlet uncovered internal documents that were intended to brief Sylvia Jones as she was stepping into her new role as Ontario's health minister. Briefings within the transition binder noted that staffing problems worsened during the pandemic and concerns about wage disparity via Bill 124 were a contributing factor.
And so for the premier to try to gaslight Ontarians into saying that, there is no crisis or Bill 124 is not contributing to the crisis was just wrong. It was wrong then, it's wrong now.
Internal documents also noted attrition has not increased. It said nurses were not leaving the profession but are leaving frontline positions. At a news conference today where Health Minister Sylvia Jones was stepping in as Deputy Premier, she skirted around a question about the documents, quickly pointing to the one-time $5,000 retention bonus given to full-time nurses and a $3 premium pay hike for PSWs.
We understand how important it is to make sure that our healthcare providers are looked after and protected in the province of Ontario.
Since the law, which caps raises for public sector employees at 1% passed in 2019, unions have been calling on the government to repeal it, saying staff are overworked, underpaid, and are leaving in droves.
What is your reaction when you read these documents?
Well, I would say disappointed is not a strong enough word.
Bernie Robinson with the Ontario Nurses Association tells me while the revelation is not surprising, it's still upsetting.
It only proves to show us that the actions of this government really are worsening healthcare. They're not improving it. We strongly believe that that is by design, that they've always wanted to break our healthcare system, and they're just using this as a justification to privatize it.
In late November, a court decision struck down Bill 124, calling it unconstitutional, saying it infringed on workers' rights to fair collective bargaining. The Ford government is now in the process of appealing that decision.
I think it's hard sometimes for people in power to admit that they made a mistake. And in the case of Bill 124, the premier clearly made a mistake.
Now, today, the Ministry of Health provided us data from the Canadian Institute for Health Information showing that there were more registered nurses in Ontario in 2021 than back in 2019, but did not answer any questions related to the frontline staffing shortages mentioned in the internal documents.